Hey everyone, I wanted to take some time to talk about how we treat the upper face with neurotoxin, whether that's Botox, Dysport, Jeuveau, Xeomin, or any other brand that you use. One of the first areas that we treat is the forehead. So you can see when I raise my brows, the forehead muscle is creating these lines, and we put Botox or Dysport or any other brand in this area to help reduce those lines. But we have to be careful when we're treating this area because this is the only muscle responsible for raising in the upper face. So if too much is placed here, you can actually make someone feel heavy, and that's not something that no one wants to feel. You especially have to be careful if someone has hooding or heavy lids to begin with, because some of these people actually use that muscle to help open their eyes. And if you go ahead and put Botox in that area, they're gonna feel heavy. So this is always an area that I double check and analyze to make sure it's the best treatment for you. The next area is the glabella. So that's between your brows. And this is usually when people say they have 11s. These muscles are responsible for pulling in and down. So when we treat this, besides getting rid of the lines you have there, it actually can give you a little bit of a medial brow lift, which everyone loves. We treat this all the time. Next is an area that not everyone does, and it's up to you whether you'd like to treat or not, but this is called bunny lines. See these little diagonals here? We treat these for people who have lines that are starting to form on their nose, or if they just feel like this muscle is just pulling a lot when they're smiling or talking. Lastly, we treat this all the time around the eyes. So this muscle is a big circle around your eye, and we typically treat like a semicircle on the outer edge. The first part that we usually treat is the crow's feet. These are crow's feet, and they're caused by this muscle kind of pulling in. So when we treat crow's feet, it actually can open up your eye and make it look bigger, which is awesome. Another spot that we normally treat and my patients love is right here. If you see this pull down right here by the tail of my brow, if Botox or Dysport or any other brand is placed here, it can actually give you a little bit of a brow lift, which is great for if you want to open up your eyes or if you do have that hooding or heaviness that you feel right here. There's also another spot that not everyone is a great candidate for, and I would always check and ask you questions to see if you are, but we sometimes treat under the eye in this area if there's lines here. And it doesn't necessarily take all the lines away, but it can help reduce that pool in this area a little bit. And we can find out together if you're a good candidate for that. So I hope this helps. Please let me know if you have any questions, and I'd be happy to see you and come in for a free consult.